Hi, good evening. Today we'll be discussing a very important aspect of practice, which is counseling. Uh, Having a counseling section with clients who have one non-communicable disease or the other. At the end of today's section, we will give a case scenario of how to actually carry out a counseling section of the patient who is suffering from diabetes mellitus. First, before you go into counseling section regarding a non-communicable disease, it requires a multifaceted approach that integrates understanding of that specific disease. You really have to show understanding about it. Then the psychological aspect of living with that chronic illness, okay, and also the techniques that requires or that techniques that are necessary to live a supportive, or let's say a technique that is necessary to support lifestyle changes. Because one thing is to talk about lifestyle changes, but another thing is ability to sustain it. So it requires techniques. So for you to really have a good counseling section, you really need to understand that it's multifaceted. It has to be a multifaceted approach that integrates the understanding of that specific disease, the psychological aspects of living with that chronic illness, and that entails in part. Then techniques necessary to support the lifestyle changes. These are necessary. So, for example, you must show understanding of non-communicable disease. You need to familiarize yourself with the various non-communicable diseases, such as diabetics. You need to know the pathophysiology, the symptoms, and how it's being managed. Diseases like cardiovascular diseases, chronic respiratory diseases like asthma, and all of that. You have to understand the pathophysiology, the risk factors, and how that disease progress as a clinician. You need to understand this. Then you also have to understand the impact of that particular non-communicable disease. You really need to recognize the physical, emotional, and social impact of living with such disease. What impact does that disease have on that particular individual and his family? You need to really show understanding uh, on it. You need to have a good understanding about that. You really understand the impact of non-communicable diseases on the person and their family. Then you need to also have current guidelines and treatment options. You need to stay up to date on the best practices in the management of that condition, the treatment options, the preventive measures, and management strategies for the disease. These are key. You need to understand that counseling a person who has this kind of condition is a multifaceted approach, which integrates you understanding that specific disease, the psychological aspect of living with such chronic illness, and the techniques necessary to support lifestyle changes. You need to understand this very well. And for you to say you have a good understanding of the disease, you need to understand how that disease process occurs, the pathophysiology, the risk factors, and how that disease progress. Then you need to also understand the physical, emotional, social, and impact of living with such diseases. And to wrap it up, you need to also understand the current treatment options, preventive measures, and management strategies. Then, on your own part as a counselor or a clinician, you need to have effective communication skills, which you have done in our previous sections. Roughly, we look at it now. You need to have the skill of active listening. You need to have that reflective listening to ensure clients feel that you are really understanding them. You also have to know how to use some verbal acknowledgements and also non-verbal clues to make sure the patient understand that you're actually hearing what they're saying. Okay. Then you need to also have the skill of using open-ended questions so that clients can express their feelings and thoughts more freely. Okay. Then you also have to maintain eye contact with this client and also use some facial expressions that reflect empathy and concern. Okay. Then you also have to have empathy and compassion. You must be able to build good rapport with those patients and ensure that the consultation or the discussion is taking place in a safe, trusting environment where the client feels very comfortable to discuss about this disease and other sensitive issue related to that disease um, disease process. Then also you also have to also show empathy, empathetic responses, okay, not to validate experiences by expressing your understanding and compassion. You really need to have the skills. Then you also have to be culturally sensitive. You need to be culturally sensitive. Understand what the person believes. You're not there to judge. You're not there to administer judgment. You're a healthcare provider. You need to tell the patient what is best for the patient to live a healthy, productive life. Okay. Also, you should be able to have behavior modification techniques. You really have to have these techniques which can comprise how to modify behavior in order to suit that current condition. Remember, we said techniques that will help sustain lifestyle changes. And such behavior modification techniques have to be in this format. You need to have goals set. You need to have a goal that you need to achieve, and that goal needs to be smart. The goal needs to be smart. You need that we're going to stop smoking. You need to really be specific about it. Then you need also to talk about action planning. You need to discuss with those patients with how to develop a clear actions and steps towards achieving that goals. Then you need also to be self-monitoring. You need to encourage the client to maintain a log in order to monitor their food diary, or if that you want to modify a patient who is diabetic, you need to really look at how they eat on a daily basis. At that point, you really need to look at the patient's food diary. Then you also need to um, put an active tracker to see how the patient is progressing. Then you need to also have the skill of increasing awareness of certain good what habits. This all will help to sustain this patient and make sure that the lifestyle that this patient is about to adopt will be sustained in order to ensure that the patient recovers or progresses along the line as you continue to monitor this patient. Then you should have a skill of problem solving. Okay, you need to really assist the client, identify some barriers to changes that is necessary. Then you also have to have the skill of brainstorming into possible what solutions. Then you should be able to help these patients in providing education and resources in order to make them understand their disease condition. Okay, need to provide clear, relevant information about that disease, including the management strategies and options, treatment options, dietary recommendations, physical activity guidelines. Okay, you also have to have the ability and the technique to assess the client's level of understanding and also tailor information to ensure the patient understands. Okay, so you need to have this necessary skills. Okay, then you need to have this emotional and psychological support skill, which includes coping strategy. You need to teach these clients coping strategies to manage their emotional strengths of living with any of these non-communicable diseases, such as mindfulness techniques, realization exercises, and all of that. Then you need to also follow up this patient to ensure continuity of care. You need to regularly check on this patient, arrange follow-up sections to monitor progress, celebrate success, and address any new challenges. Then you also have to also provide a long-term support. You need to reinforce that the counseling process is ongoing and adjusting to goals and employing strategies necessary in order to ensure improvement of this patient. Then you should also make the patient understand that their care is about 50% dependent on them. So you have to encourage self-care for that patient. You need to engage in regular supervision in order to see if the patients are actually practicing what you thought this patient. Then personal well-being is the key to living with these conditions and living a happier and healthy lives. So these are the important skills that anyone who wishes to actually provide a counseling section to a patient or a client need to really, really have in order to help the patients. Now let's look at this. Now looking at the screen, you will see this is a community healthcare worker and a woman Chioma, known as Mrs. Chioma, and Mrs. Chioma came to this clinic to see this community health practitioner. And the first phase is introduction and building rapport. So it's expected that the counselor is seated at a desk looking at the notes while Ms. Chioma enters, okay? So as Chioma comes to the clinic, you welcome Mrs. Chioma and offer Mrs. Chioma a seat and try to create rapport with this client. Hi, Choma. It's nice to see you today. How are you feeling? Now, Choma will respond, I'm fine, I'm not fine, and all of that. If you are the counselor, you thank Miss Choma for coming. Thank you for coming in. It's always a step in the right direction to seek support in managing diabetes. Although managing diabetes can be pretty overwhelming at times, what specifically is the problem? You ask, what actually brought you today? In this case, it's already established that Ms. Choma is diabetic, but in conditions where it's situations where the patient that's the first time, okay, you would just have to have a very good clocking procedure with the patient to determine what the condition is about. So this is a non-diabetic patient. You want to provide a counseling section. So you welcome Ms. Choma to your clinic or to your section, to your department, to your unit, depending where you're working in. Then you thank Ms. Choma for coming in, and always those remarks. It's always a step in the right direction to seek support in managing diabetes. And in management of diabetes can be pretty overwhelming at times. And you not ask this patient or client rather, what specifically is the problem? Then at this point, you will have to have active listening and empathy. This is where you begin to really show the person that the client that what the client is saying that you are really really understanding by using this active listening and empathy techniques. So Ms. Choma sits down, visibly relieved to talk about the concerns because you have already given Ms. Choma a good environment, attention, and belt rapport with the patient, with the client. And the client can easily feel relieved to discuss about his or her concerns. Ms. Sharma said, my blood sugar reading has been high since 3 days, and I don't know why. It feels like I'm doing everything right, but nothing is working. Then, as a counselor, you should reflect and talk and respond. It is very frustrating when you are putting in effort, but not seeing the result you expect. Let's look at, see, at this point, you are showing empathy that you really understand what she might be really passing through psychologically. It's very frustrating when you are putting in effort but not seeing the result you expect. At that point, you move to actually to develop a plan. What could be the problem? You see, let's look at what your daily routine looks like. This could help us pinpoint some areas where we can adjust together. You see, the counselor here have a good understanding of diabetic condition. That is why he has actually moved in. He says, let's look at what your daily routines looks like. This could help us pinpoint some areas we can adjust together. So, what do you eat in a day, like your meals? And what activities do you engage in? You see, the next is exploration of current management plans. You have to look at the current management options that are available based on research. Sarah takes a moment to reflect, then begin explaining her routine. Well, I try to eat healthy most days, lots of vegetable, whole grains. I check my blood sugar before meals, but haven't scheduled regular exercise. She's discussing now because the counselor has a good knowledge. I've actually brought up what you eat, your activities, and all of that. Now, the counselor looks into it. It is commendable that you are focusing on healthy eating and balancing nutrition, which is key in managing diabetes. See the response there. Based on your current routine, are there any particular meals or snacks where you think blood sugar spikes might be happening? You see, the counselor has a good pathophysiological about the disease diabetes. So Ms. Shoma will not respond. I think it could be my snacks, you see, because the client feels comfortable to discuss. I sometimes reach for fruits, but I have also been having soft drinks daily, just half bottle, no longer big bottle, and some snacks. You see, now let's proceed. Now, the counselor said, okay, let's look at glycemic index and food choices because this counselor has a good knowledge of diabetic condition and all of that. So, okay, let's look at into glycemic index and food choices. That's a great insight. Some soft drinks and snacks can vary widely in their sugar contents. Let's consider how we can choose snacks that have a lower glycemic index, which may help maintain more stable blood sugar levels. You know, glycemic index has to talk about the ability of sugar to rise in the blood from the food you just consumed, right? So, but our target is to maintain a good level of normal blood sugar level, not upper, not high, not low, not lower. So the counselor continues, would you be interested in reviewing some healthy snack options together with me? You see the approach. Yes, I really want to make the better choices. Fantastic. Also, let's talk about portion sizes. Sometimes it's not only what we eat, but how much what we're eating. Like the size, the portion. A small portion can still satisfy cravings without causing spikes in sugar. Have you been observing your portion sizes? Oh, I don't really measure. I just eat until I'm full. Now, see, the counselor will now respond in a way that shows understanding, not judgment, or say, oh, that's common. How about we set a simple goal for you? For this week, let's commit to tracking your snack portions using a food diary. Those will help you become more aware of what and how much you are consuming. How does that sound? You see, we are done with that. You see, the next is to move to the next level, which is addressing physical activities. And you know that physical activities is important in the management of diabetic condition. Great. Now let's talk about physical activity. Do you know that engaging in even small amount of exercise can greatly aid in managing blood sugar levels? Do you currently have any exercise routine? Oh, not really. I sit a lot at work. Maybe she's a typist or works in an office. I'm always tired. I understand the counselor response. It can be hard to find motivations. How about we aim for just 10 minutes, 10 to 15 minutes walk a few times in a week? Walking can be a great way to start and doesn't require a lot of time and equipment. You see, trying to recommend an exercise. One, we've looked at what the patient is consuming. Now we look at the portion size. Now we're into physical activity. Now, the next phase is to move into emotional support and mental well-being. Patients who are or clients who are having chronic conditions, sometimes it wears them down. We really need to understand this and we must work on this because if we don't work and give them hope or raise their mental well-being or contribute to that, they will always not going to follow up the advice you give. Absolutely. Also, you know, managing diabetes can be emotionally taxing. Have you been feeling stressed or overwhelmed lately? It is important to acknowledge how our mental health affects our physical health. Yeah, she responds, I do feel stressed. Sometimes it feels like it should just disappear. This my condition self, or that's completely understandable. Would you like to explore stress management techniques such as mindfulness or breathing exercise? They can help relieve some of that burdens from you. That sounds thoughtful. She responds, right? Now, the next is to look at the family. How can the family contribute to the management of this condition? Then you now bring up that because you already know there's a component in management. You say encouraging family involvement. You have to encourage family to be part and parcel of the management of that patient. Excellent. Also, involving your family can make a big difference. Do you agree with me on that? Have you talked to them about your diabetics? Sometimes a supportive environment can encourage healthier habits for everyone. Of course, when you now discuss your condition with your family, your spouse, they understand and they'll find a way to contribute. She responds, I haven't really. I think they don't fully understand what it means for me. That's what she's feeling psychologically. While the counselor responds, perhaps you can have a family meeting to share what you are going through and how they can support you. It is important for them to know how they can help. You see, at the end, we try now to review and have future plans. So the sections must not be that lengthy or too short, but it should be focused. In this, our counseling section, you will find out that we are straight to the point and the patient is there trying expressing what the patient feels, and we're showing empathy, and we are becoming more supportive and trying to explore the best practices in order to help address the concern of the patient. I am really proud of the steps we've discussed today. To recap, we will track your food portions, incorporate more healthy snacks and short walks to your routine, and maybe explore mindfulness practices. Would you like to set a time for us to follow up on these changes? Because we know that follow up is important in this counseling section, and most importantly, in the management of that condition, there's need for follow up. Yes, let's do that. Great. How about in 2 weeks? This will give us time to implement these changes and we can discuss what's working and what may need adjusting. Remember, in the earlier one with introduced this, we'll talk about setting goals and counseling section that is ongoing. Okay. Wow, closing the section. The counselor will now stand, offer a reassuring smile, and Mrs. Chioma prepares to leave. So at this end of this section, you will find out that Miss Chioma will be very much happy, filled, because Miss Chioma have learned about watching the portions, the size of the food she consumed, then talking about physical exercise, talking about incorporating his family, and also having that belief and the feeling that, yes, this healthcare worker is also planning ahead with her, because the counselor reassured her that we are in this together, and they're planning for follow-up on how to look at what works and what is not going to work or what needs to be adjusted. Having reviewed all that have been done in the past, incorporating the best practices and continually. So that's what a good counseling section should actually look like. I'm really grateful that you shared your experience with me today. Shama, remember, making small changes can lead to improvement in your overall health. You are not alone on this journey. Thanks, I feel more hopeful already, Choma replied. That's wonderful to hear. Take care, and I look forward to seeing you soon. You see how this counseling session actually have gone, and the patient will feel very good, and the patient will improve because psychologically, this patient is a bit stabilized and understand that there's someone somewhere who understands. So, as community practitioners, who work in the community, you are the first contact to those patients and clients. Having good counseling sections is important and critical for care, continuity of care, for improvement, for adherence to advice, and um, every other process that is necessary for the improvement of the patient. So it is good we learn these counseling sections. Hope to see you soon in another lectures. Thank you very much.